Hello friends, welcome to CNS Viewpoint. Just like every day, today again we are going to talk about an issue which made us think. Just right before Gandhi Jayanti on 2nd October 2021, we read that there is a white paper which has been issued by FICCI that 20% more additional tuberculosis deaths will happen because of COVID pandemic in India, and 10% additional HIV deaths are estimated to happen in the country in the coming 5 years. COVID pandemic related protocols and diversion of health services, etc., led to this kind of an impact. Also, because of COVID, routine immunization services like routine immunization for children was affected. So 22 lakh children's child are at stake, and it is expected that there will be an epidemic of vaccine preventable illnesses because the vaccination was affected of over 22 lakh children. 2.2 million children were not vaccinated. 2.2 million children were not vaccinated in the country because of the COVID pandemic and related lockdown, division of health services, etc. And this is not new. Because of weak health system, because of very fragile health systems, this is happening, and this is happening again and again. So, for example, in Lucknow in September or August 2021, I remember the news, and we featured it in CNS Viewpoint also, that the Lucknow administration had said that they will use COVID, infrastructure and resources to manage malaria and dengue, because malaria and dengue cases were far more, and COVID was kind of receding as of now, touchwood, in the city. So they thought that this is the best thing to do, which may be the best thing to do. I'm not saying about that. Similarly, in the Western UP, we read the news and we featured it in CNS Viewpoint too, that administration had said that they will use tuberculosis infrastructure to manage malaria and dengue and viral fever. The point here is, why do we have to choose between health priorities? That today we are going to manage COVID, malaria, dengue, viral fever, or other compelling health priorities. The health services, the public health services need to be so strong that they need to be serving to all the priorities, health conditions, illnesses, and also focusing on the prevention of health conditions or illnesses, because we are dealing with pandemics which are essentially to a very large extent preventable. For example, tobacco related diseases, cardiovascular diseases, cancers, chronic respiratory diseases, diabetes, all are related to tobacco. Tuberculosis also is related to tobacco. So say likewise air pollution. What about air pollution and cardiovascular diseases, air pollution and cancers, lung cancer particularly, the most deadliest of the cancers in the country and the world? So we need stronger health systems. We need stronger public health systems, and that is extremely important. And let us hope that the governments, authorities, they have understood this very clearly, or more so because of the COVID pandemic, that their call for sustainable development, where no one is left behind, could not have been more appropriate if they had acted years back, decades back. Because they did not. That is why we have such a fragile health system, such a weak health system. So with these words and with this hope that we will have stronger public health services, so that we do not have to pick and choose, that today we will have to we have to ignore certain deadly health conditions or illnesses, or some people surgery, cancer, heart disease, stroke, accidents, maternal and child health, so many other illnesses and health conditions which need urgent care, appropriate care, elderly, people with disabilities, so many more people who need care. It is important to prioritize and to make sure that essential health services are reaching out to each one who needs them in time, without delay, with dignity. So now with these words, let me conclude today's CNS Viewpoint. Tomorrow again at 5 p.m. we will be back with our thoughts and views on something which made us think. Thank you. Bye-bye. Till then. Bye-bye.